Mental health clinics. 1. Introduction. Definition of mental health clinics. Mental health clinics are specialized facilities that provide various services aimed at diagnosing, treating, and managing mental health disorders. These clinics serve individuals suffering from a wide range of psychological issues, including depression, anxiety, bipolar disorder, schizophrenia, and other mental health conditions. They are staffed by professionals trained in mental health care, including psychiatrists, psychologists, therapists, and social workers. Importance of mental health care. Mental health is a crucial component of overall well-being. Poor mental health can affect all areas of life, including physical health, relationships, and productivity. Mental health clinics play a vital role in addressing these issues by providing timely and effective care. They offer a safe space for individuals to seek help without judgment and provide the necessary support to manage and overcome mental health challenges. Historical evolution of mental health clinics. The concept of mental health clinics has evolved significantly over the years. In the past, mental health care was often neglected, and individuals with mental health issues were stigmatized and marginalized. The development of mental health clinics began in the early 20th century, with the establishment of community mental health centers aimed at providing accessible care to all. Over time, these clinics have become more sophisticated, offering a wide range of services and employing evidence-based practices to ensure the best outcomes for patients. 2. Types of mental health clinics. Public mental health clinics. Public mental health clinics are funded and operated by government agencies. They are designed to provide accessible mental health services to the general population, particularly those who may not have the financial means to afford private care. These clinics often offer sliding scale fees based on income and may provide services for free to those in need. Private mental health clinics. Private mental health clinics are operated by individuals, groups, or organizations in the private sector. They often offer a broader range of services and may provide more personalized care compared to public clinics. Private clinics can be more expensive, but they may also offer shorter wait times and more specialized treatment options. Non-profit mental health clinics. Non-profit mental health clinics are run by non-governmental organizations, NGOs, and charities. These clinics often focus on providing care to underserved populations, including the homeless, refugees, and low-income individuals. Nonprofit clinics rely on donations, grants, and volunteer work to operate. Specialized clinics. Specialized mental health clinics focus on treating specific conditions or populations. For example, there are clinics dedicated to treating post-traumatic stress disorder, PTSD, eating disorders, substance abuse, and more. These clinics often employ staff with specialized training and experience in the particular area of focus. 3. Services offered in mental health clinics. Diagnostic services. Accurate diagnosis is the first step in effective mental health care. Mental health clinics offer comprehensive diagnostic services, including psychological assessments, psychiatric evaluations, and medical examinations. These services help in identifying the specific mental health issues a patient is facing, which is crucial for developing an effective treatment plan. Therapy and counseling. Therapy and counseling are core services provided by mental health clinics. Various therapeutic approaches are used, including cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, psychodynamic therapy, and more. Counseling sessions can be conducted individually, as a couple, or in a family setting. Medication management. Many mental health conditions require medication as part of the treatment plan. Psychiatrists and other medical professionals in mental health clinics are responsible for prescribing and managing medications. This includes regular follow-ups to monitor the effectiveness of the medication and make necessary adjustments. Group therapy. Group therapy involves multiple patients participating in therapy sessions together under the guidance of a therapist. This form of therapy provides peer support and allows individuals to share their experiences and learn from others. It is particularly effective for conditions like depression, anxiety, and substance abuse. Crisis intervention. Mental health clinics provide crisis intervention services for individuals experiencing severe mental health crises, such as suicidal ideation, severe anxiety attacks, or psychotic episodes. These services aim to stabilize the individual and provide immediate support and care. Rehabilitation services. Rehabilitation services in mental health clinics focus on helping individuals regain their independence and improve their quality of life. This can include vocational training, social skills development, and other supportive services aimed at reintegration into society. 4. Staff and professionals in mental health clinics. Psychiatrists. Psychiatrists are medical doctors specializing in mental health. They are trained to diagnose and treat mental illnesses and are authorized to prescribe medications. Psychiatrists often manage complex cases that require medical intervention and closely monitor the progress of their patients. Psychologists. Psychologists are trained in the study of human behavior and mental processes. They provide therapy and counseling services, conduct psychological assessments, and contribute to the development of treatment plans. Psychologists often specialize in specific areas, such as clinical psychology, counseling psychology, or neuropsychology. Licensed clinical social workers. Licensed clinical social workers, LCSWs, provide therapy and counseling services, as well as social support to individuals and families. They often work with patients to address social and environmental factors that may be contributing to their mental health issues, such as housing, employment, and relationships. Psychiatric nurses. Psychiatric nurses specialize in mental health care and work closely with psychiatrists and other medical professionals. They provide medication management, support during crises, and general nursing care to patients in mental health clinics. Counselors and therapists. Counselors and therapists offer a range of therapeutic services, including individual therapy, group therapy, and family counseling. They employ various therapeutic techniques to help patients manage their mental health conditions and improve their overall well-being. Support staff. Support staff in mental health clinics include administrative personnel, case managers, and peer support specialists. They play a crucial role in ensuring the smooth operation of the clinic and providing additional support to patients. 5. The process of receiving care at a mental health clinic. Initial assessment. The initial assessment is the first step in receiving care at a mental health clinic. It involves a comprehensive evaluation of the patient's mental health history, current symptoms, and overall functioning. This assessment is usually conducted by a psychiatrist, psychologist, or licensed clinical social worker. Treatment planning. Based on the initial assessment, a treatment plan is developed. This plan outlines the specific goals of treatment, the therapeutic approaches to be used, and the roles of various professionals involved in the patient's care. The treatment plan is tailored to meet the individual needs of the patient. Ongoing therapy and follow-up. Ongoing therapy and follow-up are essential components of mental health care. Patients attend regular therapy sessions, participate in group therapy, and meet with their psychiatrist for medication management. Follow-up appointments are scheduled to monitor progress and make necessary adjustments to the treatment plan. Discharge and aftercare. When a patient has made significant progress and is ready to transition out of the clinic, a discharge plan is developed. This plan includes recommendations for aftercare, such as continued therapy, support groups, and other community resources. The goal is to ensure that the patient maintains their mental health and continues to receive support as needed. 6. Benefits of mental health clinics. Access to professional care. Mental health clinics provide access to professional care, ensuring that individuals receive the appropriate diagnosis and treatment for their mental health conditions. The multidisciplinary approach ensures comprehensive care, addressing various aspects of mental health. Comprehensive treatment. Mental health clinics offer a wide range of services, including therapy, medication management, and crisis intervention. This comprehensive approach ensures that all aspects of a patient's mental health are addressed, leading to better outcomes. Community and peer support. Group therapy and support groups offered by mental health clinics provide a sense of community and peer support. Sharing experiences with others facing similar challenges can be incredibly therapeutic and help individuals feel less isolated. Crisis management. Mental health clinics are equipped to handle mental health crises, providing immediate support and intervention. This is crucial for individuals experiencing severe symptoms or in danger of harming themselves or others. 7. Challenges faced by mental health clinics. Stigma associated with mental health. One of the biggest challenges faced by mental health clinics is the stigma associated with mental health issues. Many individuals are reluctant to seek help due to fear of judgment or discrimination. This stigma can prevent people from accessing the care they need. Funding and resource limitations. Mental health clinics often face funding and resource limitations, which can affect the quality and availability of services. Public and nonprofit clinics, in particular, may struggle to secure adequate funding, leading to longer wait times and reduced service offerings. Staff shortages. There is a shortage of mental health professionals in many areas, which can impact the ability of clinics to provide timely and effective care. Staff shortages can lead to burnout among existing staff and affect the overall quality of care. Accessibility issues. Accessibility issues, such as location, transportation, and affordability, can prevent individuals from accessing mental health care. Clinics in rural or underserved areas may be particularly difficult to reach, and the cost of private care can be prohibitive for many. 8. Innovations and improvements in mental health clinics. Telehealth and online counseling. Telehealth and online counseling have revolutionized mental health care, making it more accessible to individuals who may not be able to visit a clinic in person. Virtual therapy sessions and online support groups provide a convenient and effective way to receive care. Integrative and holistic approaches. Many mental health clinics are adopting integrative and holistic approaches to care, combining traditional therapy with complementary therapies such as yoga, meditation, and nutrition counseling. These approaches address the mind-body connection and promote overall well-being. Community-based programs. Community-based programs focus on providing mental health care within the community, making it more accessible and reducing the stigma associated with seeking help. These programs often involve partnerships with local organizations and schools to reach a broader audience. Advances in psychiatric medication. Advances in psychiatric medication have led to more effective and targeted treatments for mental health conditions. New medications with fewer side effects are improving the quality of life for individuals with mental health disorders. 9. Case studies and success stories. Examples of effective mental health clinic programs. Successful mental health clinic programs often serve as models for others to follow. These programs demonstrate innovative approaches to care, effective use of resources, and positive outcomes for patients. Personal testimonials from patients. Personal testimonials from patients who have benefited from mental health clinics provide valuable insights into the impact of these services. These stories highlight the importance of mental health care and inspire others to seek help. 10. Mental health clinics worldwide. Comparative analysis of mental health clinics in different countries. A comparative analysis of mental health clinics in different countries reveals the strengths and weaknesses of various approaches to mental health care. This analysis can help identify best practices and areas for improvement. International standards and best practices. International standards and best practices in mental health care provide guidelines for the operation of mental health clinics. These standards ensure that clinics provide high-quality care and protect the rights and dignity of patients. 11. Future trends in mental health clinics. Predictions for the next decade. Predictions for the future of mental health clinics include advancements in technology, increased focus on preventive care, and greater integration of mental health services with primary care. Emerging therapies and technologies. Emerging therapies and technologies, such as virtual reality therapy, neurofeedback, and genetic testing, hold promise for the future of mental health care. These innovations have the potential to improve diagnosis, treatment, and patient outcomes. Policy changes and their potential impact. Policy changes at the local, national, and international levels can have a significant impact on mental health clinics. Advocacy for better funding, reduced stigma, and improved access to care is crucial for the continued advancement of mental health services. 12. Conclusion. Recap of key points. Mental health clinics play a vital role in providing care to individuals with mental health conditions. They offer a wide range of services, employ multidisciplinary teams of professionals, and face various challenges in their operation. The importance of continued support for mental health clinics. Continued support for mental health clinics is essential to ensure that individuals receive the care they need. This includes advocacy for better funding, increased awareness, and efforts to reduce stigma. Final thoughts. Mental health clinics are a cornerstone of mental health care. Their continued development and improvement are crucial for the well-being of individuals and communities. By addressing the challenges and embracing innovations, mental health clinics can continue to provide effective and compassionate care to those in need. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.